Hello, my name is Emile Tompa, and I'm the Director of the Center for Research on Work Disability Policy. Welcome to today's session. It is entitled Disability Community Experiences in Relation to Work Given the COVID-19 Pandemic. We have three panelists in the session today. The first panelist is Pam Lahey, who is a research advisor with Employment and Social Development Canada. Dr. Lahey works on disability and accessibility matters of concern to all Canadians, including persons with disabilities. Pam received her PhD in 2018 in Rehabilitation Sciences from McMaster University. Her professional experiences as a social policy analyst has allowed her to provide input to the Ontario government on such matters as income security, employment policy, and healthcare needs for marginalized populations. Pam has authored a number of papers examining these issues in depth. Our second presenter is Christina Carr, Executive Vice President of Inclusion Canada, formerly CACL. Krista is a longtime advocate in the inclusion movement. As noted, she is CEO of Inclusion Canada, one of Canada's 10 largest charitable organizations. Inclusion Canada is a national federation of 300 local and 13 provincial and territorial associations working on behalf of approximately 1 million Canadians with a developmental disability and their families. Krista has over 25 years' experience in the nonprofit sector as a champion of inclusion. Before joining Inclusion Canada, she was Executive Director of the New Brunswick Association for Community Living. Our third presenter is Elaine Gatsios. She's a Master's of Public Health student from Queen's University, and she is presenting on behalf of CNIB and work that was spearheaded by Mahadeo Sukhai, Head of Research and Chief Accessibility Officer of CNIB. Dr. Sukhai is the world's first congenitally blind biomedical research scientist. Prior to his work with CNIB, Mahadeo served as a research scientist at the University Health Network in Toronto. Mahadeo is the principal investigator and co-author of Creating a Culture of Accessibility in the Sciences, a book based on his groundbreaking work on access to science within higher education. He also serves as the principal investigator for national projects to understand the student's experience for persons with disabilities. For today's panel, I have presented three questions to them that they are going to address through their presentations. The first question is, describe the population you studied, the objective of the survey, and other details about the context of your investigation. The second question is, what were the key findings of your study in relation to persons with disabilities and their connections to work? What recommendations follow from your research? And the third question is, what outreach to policy, community, and other stakeholders have you done in light of your findings? Thank you very much, panelists, and take it away.
Thank you to the Disability and Work Conference organizers for inviting us to this panel on COVID-19 and persons with disabilities. Is there hope on the horizon? This is being presented by Drs. Gail Fawcett, Pamela Lahey, and Lyndon Timoney from the Social Research Division, Strategic and Service Policy Branch of Employment and Social Development Canada. The goal of the presentation is to provide a past, present, and future perspective regarding what a post-COVID-19 labor market might hold for persons with disabilities. For example, what lessons have we learned from the last two significant recessions with respect to the labor market impact on persons with disabilities? Will the COVID-19 shock be like past economic shocks? What will the unique challenges of the COVID-19 shock be? Which groups of PWD will face the greatest challenges and which might be poised to find new opportunities? Could there be a silver lining? Is there hope on the horizon? If so, how can we make that happen? Let's first look at the recession of the early 1990s. This is the backdrop. Canada was heavily impacted by the recession. There were increased globalization, rapid changes in technology, and labor market restructuring that caused major shifts in the economy. Those with lower levels of education and/or skills were most negatively impacted. The 1990s marked stagnation of wages for most, but erosion for others. Employment recovery was in progress by mid-decade for many, but not for all. Let's look at the recession of the early 1990s. Is it a canary in the coal mine? From 1986 to 1991, there was increased labor force participation rates for people with disabilities. Those with mild disabilities saw an increased employment rate by 1991. However, those with moderate and severe disabilities saw no increase in employment, and unemployment rates doubled. Those with moderate to severe disabilities were already meeting serious challenges even before the recession officially hit. Could the experiences of people with disabilities be a harbinger of economic recessions to come? Well, let's look at the recession of 2008 to 2009. This is the backdrop of that recession. Canada's economy was booming during the early parts of the decade. The employment rate of persons with disabilities was increasing at a faster rate than that of non-PWD, narrowing the employment gap until 2006. Similarly, wages for people PWD also were increasing at a slightly faster pace than non-PWD, narrowing the wage gap until 2006. Even young women with disabilities who entered the decade with among the lowest employment and wage rates were improving on all labor market indicators until 2005, also narrowing gaps. Let's look at some of the risk factors during that recession. There are key differences between 1990s and the 2000 recession. Young men were the most heavily impacted group of PWD in the 2000s, and no recovery was in sight as of 2011, which is the last year of comparable data for this period. While more heavily impacted than older women without disabilities, older women with disabilities held their own with male counterparts, unlike in the 1990s. Young women with disabilities entered the 2000s with lower rates of employment than almost any other group. However, by the end of that decade, they had higher levels of employment than young males with disabilities for the first time in history. While they dropped further and for longer than young women without disabilities in the labor market, there was evidence of recovery by the end of the decade. Let's look at non-standard work as a risk factor for persons with disabilities. Heading into COVID-19, employed persons with disabilities had several critical risk factors for the current crisis. Persons with disabilities were more likely to be employed in non-standard work than non-PWD, including part-time work, self-employment, particularly for older workers, and non-permanent employment, particularly for young adults and older workers. Non-standard work is likely to be more vulnerable to job loss during COVID, and non-standard work is also associated with fewer benefits such as paid sick leave and eligibility for various employment programs. Let's look now at another risk factor, job accommodations. In 2017, 1 in 3 employed people with disabilities required some type of workplace accommodations, which amounts to nearly 800,000 individuals. And 3 in 5 of those with such a requirement had all their needs met. Many PWDs were afraid to ask employers for their required accommodations. For example, only a quarter asked their employer for accommodations, and of those, 40% were refused. Historically, cost has been an important reason for employers not providing accommodations in the workplace. Where do these persons with disabilities work? The ones that have the risk factors that we've identified. There are larger job losses being seen in industries that employ a disproportionately large number of persons with disabilities, women and youth, such as accommodation and food services, retail sales and service, art, culture, recreation and sport, education, law and social, community and government services, as well as healthcare. Employees in these industries, especially part-time or casual workers, may face additional challenges due to lack of paid leave and benefits. However, they may also be especially likely to have benefited from the CERB, which is the Canadian Emergency Response Benefit. Now let's look at the labor market for people with disabilities during the time of COVID. While we don't know what happened in the period leading up to and including 2020 for people with disabilities, until the relevant data are gathered and released some time from now, we do have extensive profile information from the 2017 Canadian Survey on Disability, from which we might speculate. Complex sets of interrelated challenges are present for people with disabilities. People with disabilities likely are disproportionately affected in terms of employment and economic security, heightened health risks, issues accessing services, less savings to rely on, last to receive assistance. After COVID-19, employers may even be more reluctant to provide accommodations for people with disabilities. However, there is a possibility that certain aspects of how work will change in a post-COVID world might also provide opportunities. Let's look at the future challenges or opportunities. The short-term and the long-term effects of quarantine for the general public have provided society-wide teachable moments. Those people who were not affected before by social isolation, lack of employment, are now experiencing what people with disabilities have experienced for decades. We're also seeing a surge in mental health related disability in the post-COVID world, or a surge in other types of disabilities. Does this provide implications for already limited resources and supports? The pandemic has also magnified the inequalities in the system and galvanized the disability community. Is there hope on the horizon? Well, let's look at the actions that have taken place thus far. There's been a renewed commitment for income security and employment opportunities for persons with disabilities. All we have to do is look at the throne speech for this and the Disability Inclusion Action Plan that has been promised. The pandemic has spurred policy action. For example, it has been a catalyst for a National Disability Inclusion Plan, as I mentioned. It also has created the COVID-19 Disability Advisory Committee. We have seen the development or the promise of the development for a national disability benefit. There's also been a distribution of persons with disability specific benefits, such as the newly released $600 payment to the DTC, which is the Disability Tax Credit eligible recipients. We're also seeing new mental health supports and greater recognition of this issue. For example, there's been a new $240 million investment in a virtual health center called Wellness Together, offering a range of mental health supports. And there is the link for anyone who's interested. Now I'm going to take you just for a moment through the key data used in this deck. We've used the health and activity limitation surveys, also known as the HAL. We've used the survey of labor and income dynamics, which is cross-sectional and longitudinal files. We've used the Canadian Survey on Disability, 2017 edition. We've used the Canadian Income Survey, 2017. And we've used the Labor Force Survey, Statistics Canada's prime source of data on employment during COVID in 2020. But please note that the LFS does not contain a flag for disability. The next few slides are references that we have used to create this deck. We are happy to share the deck for whomever would like to see it. Thank you again for your time, and we look forward to the rest of the conference.
Hi everyone, really pleased to be here with you today at the Disability and Work Conference. My name is Christina Carr and I work with Inclusion Canada, which is a national federation of 13 provincial territorial associations and over 300 local associations right across Canada that work on behalf of children and adults with an intellectual or developmental disability and their families. Employment is a huge issue for people with an intellectual disability or autism spectrum disorder, and with unemployment or underemployment rates of 80%. For a few years now, our two organizations, the Canadian Autism Spectrum Disorders Alliance and Inclusion Canada, have been running what's known as the Ready, Willing, and Able National Employment Initiative. RWA, through our efforts with our labor market facilitators, which are located in 20 primary communities, at least one community in every province and territory across Canada, undertakes efforts to increase employer awareness and demand to hire, and then aligns that local employer demand with potential candidates who have an intellectual disability or autism, and ensures that all necessary supports are in place for both the employee and the employer. The population served by RWA includes individuals with an intellectual disability or autism, and COVID-19 has and is continuing to have a significant impact on all components of the RWA initiative, including the ability to generate employer demand, access to interested job seekers, and the ability to provide needed on-the-job supports. Findings presented are based on ongoing outreach and engagement of employers, discussions and feedback from job seekers with an intellectual disability or autism, their families, and employment agencies. Findings are also supplemented by data derived from a survey of our employment agency partners. And there are about 60 that responded to the survey. Some of the key findings from the research and studies that we've been doing, experiences that we've been having through this pandemic, in terms of the impact on employers, for example, employers are hiring in fewer numbers, they're laying off employees hired through RWA, and rehiring those individuals at a lower rate. So because of COVID, people are losing their jobs, but they're getting rehired back at a slower and lower rate. Businesses need to hire quickly and are concerned about lengthy training needs, particularly regarding new or modified safety and health protocols that were implemented in response to COVID-19. Businesses are concerned that hiring an employee who requires on-the-job supports, for example, job coaches, is going to be a problem with physical distancing and the implementation of this type of person-to-person support and how that's going to work in the workplace. And businesses were uncertain of how to best support employees with intellectual disabilities or autism who are working from home when they've had to make the shift to at home. Some of the impacts we're seeing on the job seekers or employees, on job seekers with an intellectual disability or autism, were uncertain about pursuing employment in the face of unavailable or scaled back supports during the pandemic, and concerned about their own health or safety, particularly if they have a co-occurring disability that makes them more susceptible to COVID-19. Feedback also indicated that parents were concerned about the implications of employment during COVID-19 due to their adult son or daughter's health and safety, and potential transmission of COVID-19 from their son or daughter to another family member within the home. Families are also concerned about access to needed on-the-job supports, stability of employment opportunities during COVID-19, and the potential impact on health benefits of loss of employment, etc. Employers had less hours for employees. So, for example, they were closing their own businesses or are closing their own businesses at different hours and limiting their hours. So maybe they close at 5 instead of being open till 9, not open anymore on the weekends. So employers tended to give hours to those people who can do a variety of job tasks and not those that do more specialized tasks or specific tasks. Increased competition for jobs due to higher unemployment in the community and limited access to technology, Wi-Fi, internet services because of financial constraints were all things we're seeing as influencing job seekers. As far as the employment agency partners go that we have, and we have a number of them across the country, the ability to deliver needed on-the-job supports like job coaching, for example, was drastically reduced due to physical distancing protocols. Employment agencies were challenged about how to adapt and innovate in order to provide virtual support to job seekers and employees with an intellectual disability or autism who are working on-site or working from home. 52% of our agencies surveyed suspended operations, and of those agencies that had to lay staff off, most have not returned to a full staff complement within the employment agency itself. 80% of agencies reported that some or most of their clients, 25% or more, were laid off or furloughed. However, important to note that 61% of agencies reported that some or most, 25% plus, were rehired or brought back from furlough. We also have lots of data on other what the employment agencies have done to pivot, etc. And not enough time to talk about that today, but it may come up in the questions and we can certainly speak more to that. So in terms of outreach, what we've been doing as CASDA and Inclusion Canada in outreach, some of the things we've worked on are the establishment and implementation of virtual tools and platform to ensure our own RWA team makes a seamless transition to virtual work. So RWA invested significantly in moving our program into a more sophisticated online platform to ensure that our team was able to shift to remote work and that they had the necessary tools and strategies to support virtual work. All program tools and resources are available virtually with documents and materials available through Microsoft Teams, and this platform also allows our team to communicate and collaborate virtually with one another as well as our employment agency partners. Development of communications and resource packages for RWA agency partners and businesses, supporting the development, customization, and sharing of new resources for individuals with an intellectual disability or ASD was another strategy that we put in place. So specifically for businesses, specific and separate communication developed for businesses engaged with RWA who had not yet hired, and for businesses who had hired or were in the midst of hiring through RWA. So our LMFs shared that out directly. FAQs and resource packages for businesses, including links to plain language descriptions of coronavirus and social distancing protocols that they could be using with their employees with an intellectual disability or autism, and a statement posted on the RWA website and RWA staff contact information updated to ensure that they had ready access to our staff. For agency partners, certainly statement on RWA's operational status and our commitment to supporting our agency partners. We also supporting job seekers during COVID-19, which was a document that we prepared that outlined how RWA would work collaboratively with our agency partners and job seekers to make informed decisions regarding RWA employment opportunities to make sure that safety was obviously a priority for everyone. And enhanced communication and support to the WA team included particularly the development of resources to inform and support our labour market facilitators and our autism outreach coordinators, scope of work during COVID-19. And that some of those resources included expanded scope of work document to support our labour market facilitators in undertaking remote prospecting and engagement with businesses. Prospecting during COVID-19 was a document that we created to support our labour market facilitators in making virtual connections with new employees. And we had developed and shared resources aimed at job seekers, like how to apply for CERB and what does it mean to be laid off, and all of that type of information for our employees or job seekers to make sure they had the best information they could have. Increased frequency of email communications between the EDs and CEOs and RWA delivery partners, just to make sure that communication was really good and really strong and everybody was kept in the loop, knowing what everyone else needed and what the newest developments were and what the newest things that were emerging in terms of strategies that were working well to help support all the different partners, businesses, employment agencies, job seekers, etc. during COVID-19. So in terms of addressing some of the things that, that have come out of some of the findings that we've seen during COVID-19, we got some funding through Opportunities Fund, National Workplace Accessibility Fund, which was put in place to kind of address some of the employment issues during COVID. And so some of the things we're doing there are expanding our access to new online resources and training opportunities for Canadian businesses of all sizes and sectors, aimed at fostering workplace inclusion for persons with an intellectual disability or autism in the context of COVID-19. So a resource hub that's going to house a lot of information and training opportunities. Building capacity within Canadian businesses to support employees with an intellectual disability or autism using effective work from home strategies. Supporting employers and job seekers with an intellectual disability or autism in hiring and rehiring through addressing new hiring concerns and considerations that have emerged as a result of COVID-19. Generating increased tangible connections between persons with intellectual disabilities or autism and the competitive labor market through on-site training programs and in in-demand growth sectors. So one thing we've seen is that some organizations or some businesses are seeing growth, extra demand, and so we're really tailoring to opportunities in those sectors and doing on-the-job training initiatives with a commitment to hire at the end. Building capacity within employment agencies to drive the creation and use of new innovative approaches to providing needed supports to candidates and employees with intellectual disability or autism. Restoring confidence and comfort level across all stakeholder groups as to the continued value of re-entry and entry into the workforce, both during COVID-19 and the anticipated economic recovery, and driving local innovation and creating capacity for communities to undertake community projects, so innovative local projects that address the unique and focused needs of job seekers, employees with an intellectual disability or businesses with an intellectual disability or autism, and local employers in the context of COVID-19. So it's been a unique and challenging time, but certainly we've learned a lot of things, and we've been able to pivot and really start. Our focus now is on developing the resources, the training, the strategies, and the innovation necessary to support people to continue to have jobs or to keep their jobs, to change the shape of their jobs if they're working from home, to get new jobs, new people, more jobs in the context of COVID-19 and beyond, and how we emerge from this stronger and better with more employment opportunities for the folks we support than we had going in. Thanks so much.
Hello, everyone, and welcome to today's presentation. My name is Elaine Gatsios, and I'm a current Master of Public Health student at Queen's University. I completed my summer practicum at CNIB this summer under Dr. Sukhai, who is the Head of Research and Chief Accessibility Officer at CNIB, and I worked alongside Christine Robbins and Kathleen Forstall. Today's presentation will be looking at the impact of COVID-19 on employment of Canadians with sight loss. So this survey was done to obtain information about the impact of COVID-19 pandemic on adults with visual impairments in Canada. We had 724 respondents over the age of 18. They were contacted through phone and email and completed the survey in English or French. So here are just the demographics of the study population. And we found that it was consistent with the Canadian population distribution, with 67% of respondents between the ages of 35 and 64 years old. 56% identified as female, and most respondents lived in either Ontario, Quebec, and British Columbia. There was a 90% high school graduation rate, with 67% of respondents also completing some form of post-secondary education. 9.5% had completed less than high school. Most respondents had sight loss that was either moderate or significant, and this was similar between the age groups of over 65 and under 65. 35% became visually impaired between birth and 2 years old. Approximately half of the respondents stated that they have an additional disability or underlying health condition, and this was slightly higher in those over the age of 65. Just over half of the respondents, 55%, who said that they had a disability or health condition in addition to sight loss, experienced multiple conditions, and most commonly they experienced 2 additional conditions. We found that most respondents used more than one form of technology, with 26% using 3 types of technology, most commonly desktop, laptop, and audiobooks, and 20% using 2 types of technology, most commonly desktop and laptop. So listed here on the right side of the screen are the 5 most common forms of technology used, with desktop computer being the most popular, and then laptop, audiobooks, Apple iPhone, and then smartphone. Listed here are the working age group demographics. So we found that 32% were employed and 38% were employed prior to the COVID-19 pandemic. 54% had an age of onset of birth to 2 years old, 13% of an age of onset of 25 to 34 years old, 11% for 2 to 18 years old, and also 11% for 35 to 44 years old. Most respondents had a severity of sight loss of moderate or significant, and there was a 93% high school graduation rate, and with 69% also completed some form of post-secondary education. 51% of those in the working age group had another disability or health condition. So listed here is just an overview of the findings of those of working age and who are employed. So 49% said they had concerns about their employment, and 47% said that their work hours have been reduced or anticipated their work hours would be reduced. 35% said that their pay has been reduced or anticipated that it would be reduced. 60% said that their employer has directed them to work from home in light of the pandemic. 43% said that they had asked for accommodations to allow them to be more productive working from home, and 86% said that their employer introduced new technology tools to facilitate working from home. Around half of the respondents said that they were experiencing accessibility problems with any of the technology tools they needed to use for their job. So the key messages from this section of the survey was that the employment rate of the blind or partially sighted population has decreased. Pre-pandemic, it was 50%, and during the pandemic, it was now 32%. There are significant concerns about underemployment as a result of the pandemic. For further information, please feel free to contact Dr. Sukhai or I at our emails listed here, and I hope you enjoyed this presentation and enjoyed the Q&A with Dr. Sukhai today.